Welcome to an episode of TooHealthTalk, a show where we get to share each challenges in a very simple and honest conversation. On today's episode, I have a very special guest. But before we continue, please, first of all, what we're doing here, please subscribe to our channel, like, and get to share this video to someone that might need it. For you to see more doctors come on the show to talk about every health challenges. On today's episode, we have a very special guest. When I mean special, I mean top special. I used to call it their hands, like magic hand, because they get to bring life to the world. We have Dr. Asma'u in the building. Dr. Asma'u is a resident doctor, OMG. Welcome, doctor.
Thank you very much for having me. It's an absolute pleasure.
Same here. I'm so excited to have you on the show.
Likewise.
So, what is it like being, being a magician, bringing in people to the world?
It's a fulfilling specialty. So we get to bring babies to the world. We get to spread joy because whenever we hand a woman her baby, the joy on their faces, it's priceless.
Wow.
So
now you just talk about childbirth as like one of the joyful moments in life. People do not get to talk about the sad parts of childbirth. That's why I'm here today now to tell us, okay, people get to see the outer part of, oh, it's a joyful moment, the woman gave birth peacefully, but I know there is the trauma, the trauma parts of childbirth. So I really want to know what does it feel like to what's the process giving birth?
So, to be honest, childbirth is actually a very, very stressful event from pregnancy. In fact, for some people, it might even span from before pregnancy because some people struggle with having babies. So they go through IVF and the pregnancy process, then the delivery process. So it's normal to have people experience trauma through the course of bringing life into this world. And it's not something that we talk about often. In fact, I don't think there's a Nigerian statistic out there because when you check, all you get is statistics from developed worlds. And even there, I would like to believe it's underreported because oftentimes women don't even know they're experiencing birth trauma.
Wow. So what does childbirth trauma means?
That's a very broad word, or I would like to believe that it's an umbrella term for experiences or events, traumatic events that women experience either before pregnancy. Sometimes it might even be a previous pregnancy, so like a miscarriage, an ectopic pregnancy. I like to think of them as traumas associated with childbirth as well. Then it might be during that actual pregnancy where perhaps unexpected events happen. You have a child that is in distress and you might need an emergency CS. That's unexpected, something out of your control, and it's likely to be a trauma for someone. And even labor and delivery, the process of parturition. Sometimes we might need to use instruments to deliver babies. So that can be particularly traumatic. And even after delivery, you have the postpartum complications, mental health issues like the postpartum depression, and even neonatal complications. So baby is born, baby is sick, baby is born preterm, baby is in the NICU. All that stress associated with the process can cause childbirth trauma in women.
Wow. So now there's no common cause of there's no specific cause of childbirth trauma.
No, there isn't, because it's a more patient-centered definition. It's just like you say, beauty is in the hand of the beholder. It's the same thing with birth trauma. So what one person may experience as normal might be abnormal for another person. So for example, now a woman would come, probably deliver in 3 hours, and she's happy about it. She didn't spend so much time in labor. But for another woman, because what happened to this woman is precipitate labor. For another woman, precipitate labor is associated with so much pain. So that particular pain might be what would be her trauma during that birth. So what is trauma to one person is it might not be trauma to another
Another
person.
person.
Yes.
So now, like as women now that like first time mothers now that want to come in now, is there any traumatic experience they should look out for?
So, like I said, trauma means different things for different people. However, first time mothers are more likely at risk to experience birth trauma, especially because we already said childbirth is a stressful event. It's something they do not know, the fear of the unknown and all of that. So, yes, they are at high risk. So, what they can do to alleviate or reduce that is, ensuring that they attend antenatal clinics, read up resources around childbirth, because sometimes knowing what to expect as well, like, reduces the risk of trauma in these women.
So now for people now that, for like this first time mothers now, is there any period they get to look after for having a traumatic experience? Sometimes someone just have to like prepare themselves for okay, something like this is coming from. Is there a process that okay, this period is going to be traumatic for someone?
Not really, but times to look out for is usually after the baby is being born. Because, like I said, it's a new experience for them. It's usually a bit difficult navigating the terrains of motherhood. It's new, the lack of sleep, the bonding, the breastfeeding, lactation difficulties. So, those are the times to generally look out for if a woman may experience birth trauma, and signs to look out for is the excessive sadness, crying, irritability, which sometimes might even be normal, but when they become persistent, everybody needs to be worried.
So you're a mother of two.
Yes.
Was it traumatic for you?
My first baby pregnancy, yes.
It was very traumatic.
It was a very, very traumatic.
So how did you handle it?
So I had a safety net, which softened the blow, I'd like to say, because I had my pregnancy was not the typical pregnancy you'd expect. I was actually in the hospital from 19 weeks to 28 weeks.
Wow.
I was on prolonged bed rest. I wasn't even allowed bathroom privileges. I was given a bedpan to pee and other things associated with it. So yes, it was very traumatic, but what made it easier or what softened the blow was having family members around. My husband was constantly there. He slept with me every day.
Shout out to him.
Absolutely. My parents would come every day. My sisters are always there. I had a cousin coming every day, staying with me. My friends were constantly showing up with games. So it's very important for women to ensure they have a safety net because it makes it easier.
Wow. So now for your first issue now, you said, oh, like it was traumatic. For the second one, were you prepared? Like, were you like, okay, you've gone through this first phase. The second one now, okay, you know where to handle and how to handle it. Were you prepared?
I was not prepared. I was scared. I was not prepared. I was in constant fear actually, but thankfully it was so much easier than the first. And a lot of things that happened in the first prepared me for the second. So
wow. So like, what's your advice now for someone that wants to go like that's maybe watching this video now and that's maybe spending 2 weeks in the hospital now for the same issue that you have? Like, what's your advice to them?
my advice, not to them, but to their family, is to show out for them, to be there for them, to provide as much support for them as possible to help them cope. And even for the patient, perhaps, as Nigerians, we're generally very spiritual people. So we should just hang in there. It's a phase. Everything would eventually pass. And spirituality makes it easier to cope. Yes.
So now I've had parents or women after giving birth to their child, they find it difficult to bond with the child. What's the cause?
It's absolutely normal, by the way, to have a baby and not bond with the child immediately, or not want to even have the baby around you the first few hours, because what happens with delivery is the hormones in our body sharply drop. So there's that you feel different, and then the trauma of childbirth as well. So it's absolutely okay not to want your baby in those first few moments of life. In fact, a lot of people experience it. We just don't talk about it because we think it's an anomaly, but
Oh,
it's okay not to want to have your baby around you the first few moments, not to bond with your baby immediately.
well. So what about the husbands? Like they don't get to bond with their wife after giving birth. Like, what's advice you have for them?
Show out for their women. Like they need to try and support and help their women. Pregnancy is stressful, childbirth is stressful. She's now stepping into the new role of motherhood where she would have to feed and bathe a newborn. So it'd be nice if there's someone to lessen the burden, help with feeding the baby, bottle feeding the baby as while she sleeps, because she's not going to have enough sleep because she now has a new baby that might be crying or might need diaper change 2 hourly at night. So feed the baby, change the diaper, bathe the baby. Like in Nigeria, we have a problem with gender roles.
Yeah.
Dads believe they're just there to provide financially, but I think dads need to step up and be the parent that they are to their kids.
Even say me, I'm even wondering, like, that phase where they will give birth to a newborn baby and every night both parents will not even sleep. That's actually very traumatic too. Like the baby will be crying throughout the night and all like that.
Absolutely. So the parents can take turns. While one parent sleeps from 12 to 4 a.m., perhaps, the other person sleeps with the baby. And when the baby needs to be fed, one parent will feed the baby. Then from 4 to 7, another parent can take over. And the beauty of being in our society is our Mugo culture. That also helps with childbirth trauma. The fact that you're likely to have a family member that would be taking care of
Yeah.
the baby
Yeah, true.
absolutely helps after delivery. So if you have your omugo on ground, allow whatever auntie or parent you have to help with childcare. Yes, the child is yours and is your primary responsibility, but that fragile moment, cut yourself some slack, allow other people to take care of your baby while you recover.
Well, so you've produced, let's say you brought in so many lives into this world. In that aspect of your job, which of this is common? Is it the wounds? Is it the emotional wounds or the psychological wounds?
So we don't talk about these things much. So it'd be hard for me to say which is more common, but generally with the psychological ones, we have the postpartum depression, we have people seeking care. So perhaps would have statistically right now we may have more people having the psychological issues, but I'm sure when people open up and talk about their traumas, most people are likely to have experienced childbirth trauma. It's just not spoken about.
I've seen people giving birth to like five triplets or like something like. How does that feel?
Oof. It might seem beautiful, but even women that have had multiple babies are at an increased risk of having childbirth traumas because pregnancy period might not be as seamless. Delivery might not be vaginal as you'd wish. You might have to undergo operative delivery and having to take care of two kids, multiple kids, because some people have up to 4, 5, is definitely a handful. So it's adorable, yes, but they're even at an increased risk of experiencing this psychological and emotional problems.
Oh, so now when we talk about someone that wants to get married now, like and everybody's saying I want to have 4 kids. You see a girl talking to a guy on the phone. Oh, how many children do you want to have? Like that first talking stage now. Like, is there any like advice you're going to give to women for preparation of like this phase of being a mother as a mother?
Still reiterating on what I said earlier, just ensure your support system is rock solid. I don't see why a woman will get into a marriage and have kids with an irresponsible man. So ensure that your support is rock solid. Try to encourage the man to step up to his husband and fatherly role. Try to mobilize people as much as you can. For some people are not as lucky anyway. Some people might find it difficult, but just try to gather your support system and have faith.
So now, this traumatic experience now that gets to like affect the child. So, is there any possible means or advice you give like mothers to be able to like help them during this phase of like their child being so disgusting to them?
Well, with bonding problems fall into multiple categories. So you have the one that is prolonged, that is postpartum depression, and those need to seek like proper care. Then you have the ones that you see with like childbirth trauma or postpartum baby blues. So those ones are very transient. I'll just tell them to give it time. Like it's normal not to bond with your baby immediately. Just try on your own part, and it would come naturally. Every mother that is okay would want to bond with their baby, so
Well,
it
so
would
do you
come
think
naturally.
so now for people now that someone that watching this video now for the first time might be hearing about childbirth trauma, do you think after hearing about this now, do you think they will still want to give birth?
Absolutely, having children is a huge blessing. The journey might not be as easy, but having children is an absolute blessing, and there are ways to ensure these these things do not happen. So by ensuring you go to a good hospital, you attend antenatal, healthcare providers have a huge role to play. The hospital, the system, everybody just has a huge role to play. So, and like I said, what is trauma to one person might not be trauma to another person. So
now, if you want to change one thing about childbirth, is there anything you want to change about childbirth? If you ever have the opportunity to change something about childbirth, one thing.
about childbirth, I wish more people are open to painless births, because that would decrease that would okay, sorry, can I repeat?
Okay.
I wish more women would be open to pain-free births, and or maybe would be open to pain management in labor, because there are different ways to manage pain, and there's a lot of misconception around medicated birth, epidural, a lot of negative PR online, or again with our own culture, we like to glorify pain as well. So if women would explore pain-free birth, it would actually reduce the
I've never heard of pain-free births. How does that
well
work?
epidural.
Or
Yes, you get an injection on your back and you don't feel the pain of labor. Well,
whoa.
for some people it fails anyway. It's not like absolute, but for the most part you don't get to feel pain. It comes with its complications, like other drugs, like paracetamol has side effects like liver failure and what have you. It's the same way epidural too would have its own side effects. But I think it's been over popularized that okay, it's bad. There's so much negative PR around it. But
so it's not bad.
I personally, I'm not against it. I'm not against having medication during birth. In fact, I would advocate for it.
So what's your take on CS?
So, CS is a life saving procedure. However, from my own perspective, I only recommend cesarean section when it is indicated. So, if a woman needs cesarean section, by all means, it's a life saving procedure, like I said, have it. But where I have an issue is the liberal use of cesarean sections, even in women that do not need cesarean sections, because that itself can cause trauma. One, two, it also has its own long-term complications that's associated with it that people don't know. So they liberally ask for cesarean sections.
So you think they should CS should be the last option for women when giving birth?
I wouldn't want to use the word last, but CS should be an option when it is needed. When baby needs to come out fast, by all means, please, let's do the cesarean section and save the life of the baby. Or when the mother is not feeling too fine and needs the baby to be out, please, let's save this mother by removing the baby.
What's one thing you wish every woman knew before going into labor?
What do I wish every woman knew before going into labor?
None.
I can't think of anything. They should just read more about labor and delivery and be more acquainted, especially if they're first time moms. And I would also advise that they advocate for themselves. So you can only advocate for yourself when you read and you're more aware of your circumstances.
When you mean advocate for yourself, what does that mean?
So, in our healthcare setting, especially in this part of the world, there's a lot of dictating to the patient. So patients don't know why a procedure is being done for them. For example, a patient might need cesarean section, but she's not adequately counseled on why she needs a cesarean section. So the woman should ask questions. Why do I need the cesarean section? So that the doctor can tell her and she can make an informed decision on whether or not she wants to proceed with the cesarean section. Because whether we like it or not, any procedure being done on a person has to be consented. So advocate for yourself, ask questions, know what is being done, know the drugs that are being given to you. And it saves both parties. So as the patient, and you as the doctor, you know that you've informed the patient, because we've had cases where patients come and say, oh, something was given to them and they don't know what it is, and it's what caused an issue during their birth or an issue with the baby. So
So now, when we talk about childbirth trauma, what's one thing that most women needs as a support system when having that trauma?
family,
Family.
friends, spouse, even the healthcare providers as well. So everyone needs to be supportive, everyone needs to be compassionate.
So I don't know if you've seen, if you just reminded me now about these healthcare professionals. I don't know if you've seen. There's a training video on TikTok where a woman is trying to push, and matron is like saying, "Come on, push, lazy woman." I don't know if you've seen that stuff. So what's your advice for for healthcare workers partaking childbirth trauma?
I haven't seen that video and I do not hope to see it. However, we've heard stories from women having terrible experiences in the labor wards. And unfortunately, I mean, too many people have complained about it, so it can't be a lie. So I believe the system needs to be revamped. People need to know that there should be repercussions for certain behaviors. Like just because you're a healthcare provider doesn't mean you treat a patient without dignity, without respect. All the nurse or the matron needed to do was to speak calmly to the patient. Yes, the patient is probably shouting and irritable, but they're in labor. They're in pain. What do you absolutely expect from them? They can't really keep their calm, but you as a healthcare provider, you know better. So you need to calm down, provide the services that are required from you to the patient, explain to the patient why they need to push. So in a case like this, all the matron needed to tell her was, I need you to push so that baby doesn't remain in that stage for too long. Because the next thing is enough blood won't come to baby and baby will be exsanguinated. And baby can suffer from complications from reduced perfusion. So all she needed to do was explain to the mother, okay, I need you to push because so and so and so. So please try and push. Very simple.
So now, looking at you, I know you're a girl's girl.
Absolutely.
So you founded a foundation, Hope for Her. Like how, why, where did this inspiration come from you founding such an incredible foundation?
Like you said, I'm a girl's girl, so I've always wanted to do something to help the girl child. And I mean, the girl child has so many problems, but one unspoken one, or I wouldn't call it unspoken, but however, one that should be in the spotlight is menstrual health, menstrual hygiene, period poverty, and people don't talk about it. And I generally believe menstrual health or menstrual empowerment generally is at the heart of a girl's empowerment. So so many girls miss school because they don't have access to menstrual products. But when girls have access to this menstrual products, they're unlikely to miss school and they're likely to reach their full potential. So that just inspired me to try to do more for girls in underserved regions.
Have there been any like challenges you've ever faced running this kind of foundation?
Well, for now, our major challenge is actually mobilizing finances because all that I do is from the support of family and friends.
Oh,
We've not had access to grants yet, but we're hoping that we would be able to access some so that we can continue our projects.
oh, so during this course of your project now, like going to like outreaches and all, has there been any challenging moment for you?
Heartbreaking, perhaps, but challenging, not really. Logistics, people are open to us coming to bring in whatever we have to give them, but heartbreaking, yes. You see girls trying to rush us, trying to take more than we give them. I mean, all that disorderliness doesn't annoy me. It just breaks my heart because it means they are the target audience and they're in so much need. And apart from menstrual products, there's a lot of schools also don't have wash facilities, so like decent places for girls to change and all of
So
that.
do you build those wash places for them, or you
We
just?
don't have the facility, but we're hoping that we can advocate and push the government to do what they need to do, which is build decent toilets in schools for girls.
Wow. So now, before we wrap up for our child like trauma, I really want to appreciate you for like all you do.
Thank you.
Yeah. So, but before we go, have you ever had any experience? Maybe you can just share a story of childbirth trauma. Maybe someone your patients, or maybe I'm not saying you should like review patients like confidentiality, but like, is there any story of someone that have experienced this childbirth trauma?
I've had a patient in clinic who came to us 2 weeks, no, less than 2 weeks after having cesarean section with complaints of not bonding with her baby would be the right word, difficulty feeding the child, very confused as well because she's like, that phase of her life is confusing. She doesn't understand what she's supposed to do, what she's not supposed to do. But when we explored further, it was because she had absolutely no help. So what we did was to get her husband involved in subsequent visits. And also we tried to get in touch with her sister to speak to other family members to try to mobilize help and help her.
Wow. So the only problem then was the help.
Absolutely. It was just support. It was lack of support.
Wow. Like as little as.
It made such a difference. So sometimes as well, if we do that and it doesn't help, we then co-manage with the psychiatrist where they may need medications. They might be assessed for postpartum depression, anxiety, PTSD, where they can institute behavioral therapy, psychotherapy, and whatever.
Wow, all these things, women will be scared to give birth.
It's not that bad. Like I said, trauma means different things to different people. So, and what might be traumatic to you might not be traumatic to me. Mm-hmm. And again, we're having a generation of people that are emotionally intelligent. So I saw somewhere that women or people that are emotionally intelligent are more adaptive to like stressful events and less likely to develop trauma episodes like childbirth trauma.
So now you're talking about we like generation is like very intelligent,
emotionally intelligent.
Mm-hmm. Now, looking at our generation now, like our Gen Z vibes and our mothers.
I did not take into account Gen Z, please. I'm talking about millennials.
Oh.
But yeah, generally we're more emotionally aware.
Oh wow! So Gen Z is now like Gen Zs. You don't have any.
I don't know Gen Zs.
So you think giving birth now, because I know our mothers get like bear like so many like pain. I don't know if there's a difference now like of our generation in Gen Z.
Yeah, I think Gen Zs would likely they like soft life. No, they would likely explore birth with epidural, hypnotherapy, and what have you. So yes. And those are amazing coping mechanisms, like I said. So my first baby, I had an epidural which didn't work at the end of around the time I was supposed to push my baby. So it was really painful. But my second baby, I had an epidural, and my oh my, it was amazing.
So you're going to advise Gen Z like,
Well, for each their own, but I'm all for pain-free birth.
hope for the best.
We hope for
Maybe,
the
maybe
best.
the next, how many years like staying out to give birth? I don't know.
Are you? Do you have a uterus?
No, I mean my wife, in case.
Of course, of course, of course.
Okay, let's see, like, because I know like our mothers, like they go through a lot like of pains, like giving birth. But these days you will see a Gen Z saying, I don't want to give birth to, I don't want to like
Yeah.
go through stress giving birth,
And that's
having babies.
absolutely okay. We're overpopulated in the world. We need to, slow down a bit. So 1 or 2 kids is enough. And our parents used to like to glorify pain. We have like a sufferness mentality. Just because I
Yeah,
suffered, I think you should suffer too. We need to break that cycle.
Okay, thank you so much. I've like so much like I've learned a lot. Maybe when I want to get married, I'll come out rewatch this episode,
And you have my phone number too.
Sure. Like, what is your magic? Like me, I used to wonder how people used to like. I feel like people in O&G used to feel like mini God
Well, we don't, but okay.
because you guys used to bring people out to life. That's how I feel. Mini God, like, and all of you have one kind of steez. Like I've seen, like, yeah. My MD is like O&G consultant. She used to have that steez.
Lovely,
Yeah. So
lovely. I'd love to meet her someday.
Sure, don't worry. I'll introduce you to her.
Lovely. That's nice, actually.
So thank you so much once again for
Thank
coming
you
on the show.
too.
I so much enjoyed our conversation.
Likewise.
So if you've watched up this moment, I want to thank you for sticking with us up to this moment. And please, I'm pleading once again, if you want to go what we're doing here, please like, share, and subscribe to this channel for you to be able to see more doctors come on the show to talk about many and like so many topics. See you in our next episode. Bye.